Hello everyone, welcome to another Max Talk. Today we are going to discuss a very pertinent topic which is a cause of worry for many people, that is sudden increase in cardiac arrest cases, especially amongst the younger audiences. Our speaker of the day is a very eminent personality, Dr. Balbir Singh, Chairman Cardiac Sciences here at Max Healthcare.
Hello, everybody.
A very warm welcome to you, Doctor. There are a lot of researches right now which are talking about a sudden increase in heart attacks and heart related diseases. Specifically, if you talk about Indian market, Indians seem to be at a higher risk of heart attacks. Younger audiences like 30 to 40, 50 years of age seem to be at a higher risk. That why and what is causing sudden heart attacks?
So, if we look at the first thing, is sudden cardiac death related to heart attack? Because sometimes people think brain attack may have happened. So, WHO is very clear. Cardiac is the only reason for a sudden death. So, sudden cardiac death has been given a very important preview by WHO. So, that means it is of importance in the world that people die of sudden death. So, sudden death is generally due to the heart. Sudden death is very common, is the commonest reason why people die suddenly. Sudden death is very common in India, and we are seeing younger people die suddenly, and heart attack incidence in young people is going up day by day in our country. So these are facts and figures which we can't deny.
So while we spoke about increase in sudden deaths amongst younger audiences, if we specifically talk about cardiac arrests now, what do you think are the causes behind that?
So first thing is, how does a person have a sudden cardiac death? That is the first question. So the question is how these young people who are absolutely normal, maybe athletic, maybe running around, and suddenly one day just pop out. And we have so many examples sitting right in front of us who did that, and we know about it. So what makes it that people die suddenly? The heart, which was functioning so well, suddenly dies. So one of the reasons is an acute heart attack. So an acute heart attack can come out of the blue. Acute heart attack will generally give some warning over a preceding 1 week in form of some symptoms where there will be some congestion in the chest, some uneasiness in the chest, which generally passes off as acidity. So many people just think that कुछ एसिडिटी हो गई, रात को बाहर खाना खा लिया, एक ड्रिंक एक्स्ट्रा ले ली, एसिडिटी हो गई. This is very common. I hear it every day. And when we investigate further, we find out it is a heart blockage which is going. So such symptoms, suddenly then one day you will find that the artery just blocked off and the patient had an acute heart attack and died. So one fact is also there that majority of heart attack patients do not make it to the hospital. That means they die before they reach the hospital. So why is this happening? Can we do something about it? Is the bigger question than this. So my thinking is that the awareness that such a thing can happen, the awareness that heart attack needs a constant, immediate physician care helps a lot. So God gives you warning time. It gives you time. It is not always out of the blue that such a thing happens. Then there is another group of patients who have a poor left ventricle function, poor heart function. They may have had heart attacks in the past. They may have diseases which we call cardiomyopathies. These people are at risk of sudden deaths. This is preventable because when a patient comes to me with a low heart pumping efficiency, I know that this patient is at risk of sudden death. I can give him some medicines, some devices which can help him out of acute heart attack and acute death. So this is all about understanding what it means.
So doctor, you spoke about sudden congestion to be one of the symptoms people should be looking out for. Are there any other symptoms to be careful about? Any immediate action that people should take in case of such symptoms?
So the operation on the chest with sweating, jaw pain, throat, somebody says that my throat seems to have stuck. I feel that somebody is holding my neck. These are very common symptoms, which when patient comes to me and tells me these symptoms, we know that we are dealing with a heart blockage. We know we need to act immediately. We can't wait. We shouldn't wait and act immediately to save a life. So these symptoms, awareness by all families, all people is an extremely important area. Then there is another symptom, a person who goes for a walk every day. suddenly one day comes and tells me that, sir, I went for a walk today, but I felt as if something was sitting on my chest. I had to sit down and was relieved immediately. This is a classical angina. A new onset angina means that it could be turning out into a heart attack. These are some of the warning symptoms which most patients, when you talk to them, patients whom I treat for heart attacks, when I talk to them, they will give me a history which dates back to 7 to 10 days that yes, something happened on that particular day. He felt that. Now, if you ignore that, you could be making a total mess of the situation.
So that brings us to a very important question, that are there any preventive measures that people should follow, or is it up to the fate that something like this can happen and you can't do anything about it?
Right. So we are left in mercy in many situations, but awareness, working systematically, understanding your risk factors, altering your lifestyle is all very helpful in reducing the incidence of heart attacks, in reducing the incidence of sudden death. For example, if a person doesn't smoke, has a good lifestyle, keeps his cholesterol, hypertension, all in check, he has a much lower chance of having a sudden cardiac death than the one who is obese, who is diabetic, who is not taking care of his diabetes, who is smoking, drinking a lot, and has an abdominal obesity. So you will see an abdominal belly. These are the patients who are the highest risk, and one should be very careful, and this matters a lot. People tell me that वो तो एक बहुत पतला सा था, उनकी death होगी, but there will be hundreds of obese people who would have died. So all these factors are so important that more I talk about it, more the media talks about it, even then it is less, because this is a lethal disease. This is not a simple disease to have.
And doctor, you briefly spoke about lifestyle and lifestyle related issues like diabetes and hypertension having an impact on sudden cardiac cases, specifically because we are talking about younger audiences getting these heart attacks. Anything more that you would want to elaborate on?
So I would elaborate on one fact which people must understand. If somebody's family is told that patient has a cancer, there is a complete reaction from the entire family members, all come around and help that patient. They will do everything. They will take him to Bombay, New York, wherever they think a better treatment is available. But I want to remind people that there are more heart attack deaths than cancer deaths. That means we are talking of a more lethal disease in form of heart attack which can come unannounced. So you have to prepare for it as if it can happen to anybody. Nobody is immune to it. Think that it may happen to you. Take all the due precautions because it is preventable. It is clearly preventable. One of the reasons why I say it is preventable is that we know the incidence of heart attacks have been reduced in America and many European countries, where these precautions, lifestyle measures have been followed, where smoking incidence has come down, where people are very careful about cholesterol, about their diet, about exercising, about walking. This has led to a reduction in heart attacks. So this can happen in India. India is going up in numbers of people who are having heart attacks, particularly the young. So we have to take all the due precautions because it is helpful and because we understand that this is a leading cause of death.
This brings us to the last question. Do genetics and family history have any role in such cases?
So genetic history and family history is one of the very important factors, and it gives clues to everybody. So if a parent had a coronary artery disease or a heart disease, has stents or a bypass surgery or a heart attack, he has to teach his children that, look, you are at high risk, because they are going to be at very, very high risk. And if we teach them good manners right from the beginning of their life, right from the school days, they will learn much better than once they reach their 40s or 50s, and then telling them that do like this may be more difficult. So genetic and family history is very important. We always ask that history. Supposing a patient comes to me with chest pain which does not look like a heart pain, and I do an ECG which comes out normal, I do an echo which is normal. Next question I ask is, does any brother, sister have a heart attack? If he tells me, yes, I'm very active, I will do an angiography or do whatever to rule out a heart attack. I will not then wait, even though the pain did not suggest a heart, but I will be doubly sure in my testing, do a angio, whether it is CT or a normal angio, but do something to make myself convinced that this is not a heart pain, this may be just a muscular pain. So family history helps us guide treatment in many patients.
Thank you so much, doctor. This brings us to the end of this live. Just an ending message if you have any for our audiences.
So ending message is that one should not get frightened that we are looking at sudden cardiac deaths happening more often in our country. We should be proactive, save ourselves, have lifestyle changes, and be proactive when some symptoms come up. Because as I told you, there will be a prodrome, there will be something which suggests that this could be heart. You could rush to the hospital. Just 2 simple tests, one blood test, ECG, can be done right there and rule out a heart attack and give you that comfort that you go back home happily. And if it is a heart attack, it gives you an opportunity to be treated as soon as possible, which we call the golden hour of the heart. So if somebody is treated in the golden hour of the heart, where there is very little damage to the heart, he can lead a normal life. So proactive treatment of symptoms and preventing with a good lifestyle is the key. One should not be scared. One should actually take these messages and work hard to prevent a heart attack.
Thank you so much.
Thank you so much.